Good afternoon. On behalf of the Indigenous Determinants of Health Alliance, thank you for joining us today. We will start our press conference off with an opening statement by Jeffrey Roth. He is the United Nations Permanent Forum of Indigenous Issues expert member and the CEO of the Cedar Rock Alliance. Jeff?
Thank you. I'm so glad you guys are here today, and we want to talk a little bit more about the study that we introduced this morning at the Permanent Forum. Again, I want to acknowledge that, this report and concept came from the Global Indigenous Youth Caucus in 2022 when they asked the forum to look into the health of Indigenous people and Indigenous determinants of health specifically. So the Indigenous Determinants of Health Alliance is made up of 22 Indigenous researchers, politicians, and policy experts, and 3 Permanent Forum members, and we represent all 7 sociocultural regions that the Permanent Forum acknowledges. Our study expanded on the previous Indigenous Determinants of Health study from last year, where we specifically identified the 33 risk and protective factors that ensure the health and wellness of Indigenous people, and also identify indigeneity as an overarching social determinant of health. And we're looking to see the WHO also include that in their upcoming draft on the social determinants of health. This current study really talks about more of operationalization and practical guidance that comes from the determinants of health, comes from the authors group, but also comes from the Permanent Forum's previous recommendations on what UN agencies need to do to ensure cultural safety for our communities across the globe. We had specific objectives this time that we wanted to look at, including providing guidance on implementation of systemic and structural changes so that we could address Indigenous health and wellness. We wanted to create a dialogue in critical areas in order to eliminate systemic apathy towards Indigenous issues that we see across the UN system and in member states. We wanted to equip Indigenous leaders, community leaders, with culturally safe approaches in order to advance their issues at the local, national, and international level, and clearly demonstrate the connection between self-determination, tribal sovereignty, and Indigenous health and wellness, and reinforce a rights-based approach to health, avoiding categorizations such as stakeholders or minority, which continue to create a minoritization of our population across the UN system, and then also provide a framework to respond to the recently passed World Health Assembly's resolution to improve the health of Indigenous people, and includes a requirement for a global plan of action that we'll see in 2 years. So that's kind of an introduction to what we were hoping to accomplish with this, and I'll give it back to Ned, and we'll have a couple questions, and then if there's anybody that's online or in the audience that'd like to ask a question, we'd appreciate it.
Thanks, Jeff. Before we take questions, quickly, I'm going to introduce our panelists. Immediately to Jeff's left is Alejandro Ramirez del Valar. He is the coordinator of the Indigenous Determinants of Health Alliance, and his head nod lets me know I said that correctly. Stacy Boland to his left is the CEO of the National Indian Health Board. And then to her left is Emma Rawson Te Patu, who is the president-elect of the World Federation of Public Health Associations. So that's our panelists. We will take questions. We will also offer some to the panelists as well. So I will ask the questions. You guys can pass the microphone. Feel free to piggyback on one another as we go along. So I think the first thing that we want to ask is, how does this report and the previous report help advance the health of Indigenous peoples?
Okay. Come on, you guys have to talk too, but I think prior to this work and really looking at what are protective things that protect our communities globally, and what are the things that are regressive for our community, and specifically putting them down. I don't think that people had a really clear idea about how to approach Indigenous people globally. I'll say, at least from my experience in the United States, I don't think that agency officials in our federal government quite understand what they need to do to improve the health and wellness. They've been trying for a long time now and haven't been able to do that. So we wanted to make sure that we were able to identify that and put in the overall consciousness of the World Health Organization the need to ensure indigeneity as an overall determinant of health to ensure that these factors are looked at.
Thanks. I guess very similar to what Jeff said. I think, it's the statement and or the question, if not now, then when. We have the evidence around what Indigenous peoples have needed for decades. And as Jeff has alluded to, some sort of roadmap, a recipe that people are able to understand, which is what the Indigenous Health Alliance has really put on the table, is a very clear road of travel, a very clear direction about what organisations and people can learn about how to operationalise the Indigenous determinants of health. But first and foremost, to acknowledge them as something that is important, that is of value, so that we can stop having the circular conversations that we're always having.
Ani Buju, Indigenous Cosmic Kwe. Hello, my native name is Turtle Woman. I am a citizen of the Sault Ste. Marie tribe of Chippewa Indians located in the Upper Peninsula of Michigan in the United States. Yes, 25% of the world's fresh water is there. I think it's very important to look at the operationalization of colonization and the methodologies that were used successfully and consistently in nation after nation that led us to a point where our health is the poorest on earth. When colonizers first encountered North America, they repeatedly reported back to their sponsoring crowns that we were the healthiest people they had ever encountered on the planet. We had no blemish among us. We were without disease. We were without injury. Certainly not how we would be described today. And as we say at the National Indian Health Board, Indigenous people of this world are tired of winning the race to the bottom for health status, health systems. We have within our possession, despite centuries of effort to separate us from it, Indigenous knowledge, Indigenous ways of being, Indigenous ways of defining what health is, that collectively strengthen us and individually bolster us to have full health. The Indigenous determinants of health, the time is now to have a commonality recognized among the Indigenous people around the world, that we together hold the answers to our own health. We always have. And it is shocking that it was not until 2023 that the World Health Organization had a single resolution calling attention to or prioritizing Indigenous health. And when we say the time is now, literally standing on the victory of last year and having Indigenous health be a priority at the World Health Organization. So let's move this forward to actually realizing full health our way on our terms, working collaboratively to do so through the Indigenous determinants of health.
Yes, my name is Alejandro Bermudez, and I'm the coordinator for the IDHA. I just wanted to add that I think this report and also the past report on Indigenous Determinants of Health provide clarification. It seems like since the beginning of the conversation about social determinants of health, Indigenous communities have been like saying, you are not actually addressing me correctly. And this keeps happening, and then the UN system keep telling like, okay, so I'm gonna tailor it, I'm gonna customize it, and it has never been done correctly. In this case, I think these two reports provide tools and a clarification so that the UN agencies, including WHO, PAHO, and any other agency, have the right guidelines. So they can no longer say, oh, I don't know how to address you because, like 18 researchers from around the globe have been providing their knowledge to clarify as much as possible, at least to provide some guidance, so that the agencies can discuss with local communities or the indigenous communities in a way that is more knowledgeable. So I think just providing the guidelines is unique, and yeah, that's all I want to say.
Thank you.
All right, thank you very much. As Alejandro alluded to, this report is about the guidelines. So can you guys talk a little bit about if an organization, if a member state, if an agency has adopted the IDH, sort of how this report works or what some of the next steps is that they can take specifically that are outlined in that report?
So this report about operationalization in some ways I felt like was a step back. So we put the policy out there and we said, hey, this is what you have to do and this is how you have to get there. And then this year's report I think is more of a guide about how you get there and providing them steps and how we're referring to them as rights to ensure that your country or your entity is prepared to implement the indigenous determinants of health. You know, we split this guide up into two real sections. One is specifically about, you know, what are some intersectional items that need to exist for entities to be ready, including UN agencies, to be ready to tackle these determinants of health. But then we also talked specifically about 5 fundamental rights that have to be recognized by any entity that is interested in trying to improve the health and wellness. And let me read the 5 rights that we identified quickly so that you can kind of get a feel for where we're at here. The first right is the right to representation and meaningful engagement. The second right is about the right to meaningful approaches, interventions. The third right is the right to self-determination, evaluation, data collection, and holistic methodologies through an indigenous perspective. The fourth right is the right to know and care for our lands and environment, including to be in relationship with our surroundings. And the fifth right is the right to just policy processes and procedures for indigenous communities. So that's kind of how we framed this specifically. Anybody else want to add? Okay.
Jeff was so good that no one else could cover it. Thank you, Jeff. On a similar thing to one of those rights, can you talk about how agencies, organizations, member states can avoid tokenization in this process?
Everyone's on that one. Tokenization, come on.
Yeah, so I'll speak from the perspective of current practice that we're, I guess, demonstrating in the World Federation, and it is around understanding what it means to authentically engage in this process. And for the Federation, what that's meant has been the traditional leadership, which has been European and white men in leadership who are absolutely amazing people, but recognising that they need to step out of the way and make space for Indigenous people to actually lead in the strategic direction of the organisation. And so this is one of the elements that's been spoken about within this work, is like who are the people making the decision? How is power shared through all the levels of structures of organisations? And it's really important to say also that, ultimately at the end of the day, systems and barriers within systems exist because people perpetuate them as individuals. So this gives you another way to look at your own practice and how can you begin to, as a personal practitioner, understand your organisation and help by leading your organisation in a way that addresses, understands and acknowledges indigeneity and the Indigenous determinants of health.
Another here, all the way around. And to speak more to that point, recognize, embrace, and move aside for the reality that Indigenous peoples are perfectly capable of engaging in this space with a great deal of efficacy, intelligence, and a level of understanding and knowledge, and a type of understanding and knowledge that has not previously been enjoyed by these bodies. There is so much to be gained by making room at the table for all of us. And leadership in this space, representation in this space, it is really challenging because there's very little funding for organizations that represent, in the United States case, tribal governments, tribal organizations that are under the authority of tribes. And around the world, we hear this repeatedly, there's very little funding to support our ability to learn and become effective in this space that has not had open doors for us. We are pushing those doors open. We have allies and friends who are helping us do so, but we need to have dedicated funding for this work so that those who have the privilege of funding are not trying to carry our voice for us. We don't need that kind of help.
I did an intervention yesterday or Tuesday, I believe, during the forum where I talked a little bit about, I think, two of the rights, one being tokenism specifically, but another one being about the need for just processes for Indigenous people. You know, so often I've run into, and I see this, gosh, more than I'd like to admit, but I see UN agencies specifically engaging with certain individuals, and quite often they have financial relationships with these certain individuals and claiming that that meets their requirements for free prior informed consent or to get advice from Indigenous people on working things. To me, that is not engaging in meaningful dialogue with Indigenous people before you move forward. We also see in the realm of tokenism, especially when there's money involved, we see a lot of organizations pop up out of nowhere that, and I'll just say it, they are in oftentimes reorganizations of non-Indigenous organizations so that they can, suck up the money that is allocated towards Indigenous people. These organizations do not have Indigenous leadership, they do not have Indigenous boards of governance, and they do not have Indigenous staff. Yet they have really pretty websites that have wonderful pictures that are free online to create these websites that look Indigenous. And that's another significant problem in our community, making sure that Indigenous leadership is the ones that are leading the interventions and the projects with the UN system.
Thank you. As Jeff alluded to, is my next question is, can we talk about self-determination and sovereignty as it relates to implementation of the Indigenous Determinants of Health?
I think we just alluded to that. In order for anything to be recognized or for us to have any voice, we need to at least have recognition from the UN system that and honoring of the United Nations Declaration on the Rights of Indigenous People, of our right to self-determine and have our own autonomy in relations to these types of issues. Quite often, these issues that I was talking about before really are about how they influence to get the decision that they want to have or the advice that they want to have to create whatever they want to do. I would also say, there's also a real clear exclusion in a lot of conversations as well. I just saw, I'll leave the agency nameless at this point, but I know that there's a event that's taking place in conjunction with the Permanent Forum on Indigenous peoples specifically, and it's an environmental event. And yet there's not one Indigenous person that is on the panel or seen as an expert in this space. This is a UN agency that is promoting that as part of this session, and yet there's no Indigenous people involved in it. There is no working with us or for us or at us without us and our leadership. I saw your hand twitch.
I was twitching. I was enthusiastically agreeing. Do you want to speak?
No,
Do you want to go first? Go ahead.
I think my response to the question or the statement is I can kind of go back to something that I said yesterday. There's still this situation where history hasn't been fully accepted and acknowledged. and that we can't move forward until that point, because there's always then a yes but. And the yes but is still not acknowledging Indigenous intelligence and the value of Indigenous intelligence, which goes back to, who's at the table, who's making the space for who. If we're not fully acknowledged in our own context, in our own history, then how can we fully participate and fully exert our sovereignty? Because no one has to give us our sovereignty, we already have that. It's just the acknowledgement of the position and the place that we hold and we have always owned that needs to be recognised.
I wanted to also add that there was a lot of presentation here, and communication has been consistent that Indigenous nations are nation states and need to be recognized as equal players at this table at the United Nations, particularly in the Forum for Indigenous Peoples. And that is often not how the opportunities to be heard are prioritized. So that's a very simple fix that would be have an incredibly profound impact.
Thank you very much. Emma, yesterday you said nothing about us without us, which I think alludes to that point. But so to my next question is really about research and data with regards to Indigenous people. So can we talk more about culturally safe ways in which to do that research and get that data, recognizing the Indigenous determinants of health?
Let me start, and then I'll get them riled up, and then they'll join. Well, first and foremost, there needs to be an expectation of respect of Indigenous knowledge, Indigenous scientific knowledge, and Indigenous research that doesn't exist right now. There needs to be inclusion of Indigenous researchers on scientific committees across the UN system, and meaningful input and recognition, meaning that these individuals have full voting rights and are respected, and their discipline is respected. There also just needs to be we need to ensure that we do data collection and reporting. So often, as I know all of these advocates, we run into the fact that we don't have any data from which to advocate. And so there needs to be a real concerted effort to make sure that that data is included in larger data sets, and that we are testing, questioning, and making sure that we have those of us represented in data sets.
Yeah, all of what Jeff said, and then I would say go to the next level and say it's not as much about inclusion as that anything around this, or really anything to do with Indigenous anything, needs to be led by Indigenous people, because inclusion can mean many subjective things. So it needs to be led by Indigenous people.
And there also needs to be an understanding of who owns the data about Indigenous people, and the respect for the fact that doing research about all the knowledge and the wisdom and the our ways does not mean patenting our knowledge and selling it back to us or to anybody. That knowledge is owned by us, and it needs to be treated as sacred and protected as such.
Go ahead, sorry.
I wanted to mention something that is included in the report, and that was, it's an idea that was pushed by Dr. Kelleher and Dr. Redvers about context. And also include the indicators in the data that Indigenous peoples prioritize. I think those two are very important whenever they are collecting data about Indigenous peoples.
Yes, I agree. And I also want to just highlight, maybe this is a question you have later, but I want to highlight some of the entities that we are seeing that are respected globally as, science-driven entities that are starting to understand the importance of what we're doing here, the conversation we're having here about Indigenous determinants of health and Indigenous knowledge. The T.H. Chang of Public Health at Harvard recently put our report out as a recommendation to member states in how they interact in the CBD forums. They said that this needs to be the policy for how member states interact around biodiversity and ecology. We have a a couple articles in the Lancet Journal that have highlighted the report. We have another one coming out tonight at midnight as well. That will be an exploration of the work around in celebration of Earth Day this weekend. The Planetary Health Alliance has also put out this document and encouraged all of the Planetary Health Alliance agencies around the world to adopt this as their tool and framework for how they interact with Indigenous people globally. And then specifically in the United States, the National Indian Health Board has adopted a resolution for its framework for how it interacts with the federal government, as well as our national tribal organization, the National Congress of American Indians.
Thank you, Jeff. Nobody mentioned it, so I'm going to throw it out there. But in the context of research and data and indigenous knowledges, can we talk about traditional healing and its incorporation into all of this?
Well, I don't have FPIC to talk about that right now. Just kidding. It's an important part of our traditional medicines that needs to be respected and included in our communities. It is intensely personal for every community and every region. And so, alluding a little bit to what Stacy said about the commoditizing of our traditions, there is an intense conversation happening right now within the UN health system on traditional medicine. And I would say that there are extremely intense financial gains that are possible here. And so in a lot of ways, I feel like we're getting pushed out of that conversation because it's really about big business that is leading that conversation, unfortunately. Indigenous people need to have a significant and major role in any conversation on traditional health and well-being and how we move forward on that.
Good job riling me up. One of the things that I want to just circle back to how we began this discussion. Indigeneity itself is the framework of indigenous determinants of health. The colonization experience is a commonality that defines the reality of where we are now. And our resilience factors speak to the fact that we've survived and we are still here. But there was great investment made to separate us from our languages, our cultures, our traditional ways of knowing, our traditional healing. And in the United States and in other places around the globe, our religions were outlawed. And spirituality and the way that we express ourselves through mind, body, and spirit are essential to defining our health. So the idea that that can be commoditized is appalling, and our medicines and our knowledge has to be protected as our own. There is a consultation going on right now with the UN to gain commentary on traditional healing, traditional medicines, and that opportunity closes on May 6th. So those of you who are in this audience, tribal, indigenous, nation states globally, this is an opportunity to be heard, and numbers count. The number of us that respond create the assurance that we're paying attention and there is presence. So you can go to our website at www.nhb.org at 5 o'clock today, because it's not there yet, Eastern Standard Time. And we'll provide some information about how to be engaged in that commentary process and how to be part of our voice in protecting our traditional healers and our knowledge.
Yeah, thanks. I think Stacey said pretty much everything that I thought that I'd like to say, but again, double down on, the spiritual aspect of the practice of traditional medicine, or as we call it, rongoa in New Zealand, is as much important as it is about the plants themselves and how the plants grow, how they're collected, but the spiritual practices, the ceremony around how they're utilised, that is a challenge for the Western world in terms of seeing those things as valid and those practices, and that, as Stacey has said, need to be absolutely considered in any conversations around how we're looking at those.
We're only now starting to heal. and starting to regain our knowledge and our traditions after centuries of policies that separated us from them. Now is the time to continue boldly moving forward.
I just want to add a little bit more about the conversations that are happening here at the UN. Again, I'm nominated by Indigenous organizations, so I can say what I want. And we see the countries that are most objectionable to having Indigenous people involved in these conversations, the ones that stand to gain. And I would say countries like China that don't acknowledge their Indigenous populations in a meaningful way, or get FPIP from their communities. I would also say the conversation has been a little diluted because of India's presidency of the G20. And so meetings have been occurring in India, but I don't know that they're occurring in the best way. This year we have a new G20 president in Brazil, and I'm hopeful that these new conversations that are going to be taking place in Brazil will lead to more fruitful participation of Indigenous people.
Thank you, all of you. We are running near the end of time, so this could be our last question. This week's session has been focused heavily on youth and the youth of the Indigenous peoples. What would you say to a young Indigenous leader on how they help advance this cause?
That's a good question. I have to say that I have been so tremendously impressed by everything that the youth have done here. And it has been heartening to me to see the next generation coming. We're in good hands. They're coming, and we're in good hands. I already have youth that are speaking to me and wanting to be engaged in this process. And so we will definitely include them in the work that we're doing and moving forward. One of the most organized bodies that participates in the permanent forum here is the Global Indigenous Youth Caucus. I think they had over 200 people that were meeting the weekend before this forum to organize themselves, to organize their messaging, to elect leadership, and to move forward. And they meet every morning as well before the permanent forum to ensure that they're ready to go. It's been extremely impressive, and I want to do everything I can to support the participation and movement forward. I think one other thing, and I would just really encourage mentorship and internship from individuals. The more funding and opportunities that we can have to have youth shadow or be involved in policy-making processes and involved at this level, I think is going to be very valuable as we continue to move forward.
Do you want to speak? I'll go after you.
Yes, thank you. Sovereignty, that's what we've seen these young people exert I've seen these young people exert this week, is their sense of sovereignty over their lives, a great sense of clarity and a great sense of purpose that's inherent in all of us. And one of the things that I know that I've seen in the space that I'm working in is that being present is everything. So continue to be present. Be in the spaces that you believe that you should be in, because you should be there, and no one else should tell you different. If you believe in something, do it.
I agree with everything and want to bolster that. The words that I feel to say now are about the 7 generations. When I will speak from a United States perspective, to not pretend that I have deep knowledge or authority anywhere else in the world. But in my experience as an American Indian woman, our people who negotiated our treaties were watching their lives evaporate. They were watching everything they knew be destroyed. They watched the death of children and women and our elders for the sake of breaking our spirits and our hearts. On and on. You know the story, but here's the thing when it comes to our youth. They dreamed you. They dreamed you. They knew you were coming. when those treaties were written, how could they possibly have known we would need to be protected for health? We would need to have education. We would need housing. We would need food. They dreamed a world that was beyond their sight, but has come to pass. You are who they dreamed. You have all authority to stand on that and be present.
I just want to say thank you to the Indigenous youth. Thanks to that sparking that idea about the Indigenous Determinants of Health, 2 years later we have a framework. So I would just thank you. Yes.
Can I add one more thing off topic? I just want to, one of the things that has been a difficult learning curve for me within the UN system is, how do we get down to brass tacks is how I would say it. Like, how do we ensure that we can, create implementation across systems? How can we give tools to individuals that are actually practical and actually meaningful for our member states and for our UN systems? We've tried to create 2 practical implementation documents that came specifically out of these reports. The first document directly maps to the World Health Organization's social determinant of health levers. It maps the indigenous determinants of health specifically to the World Health Organization. So it's clear to see for individuals that are working in social determinants of health work, as well as individuals working in our indigenous communities, how it relates to the social determinant of health levers. And these, by the way, are the new levers that the Social Determinants of Health Office at WHO will be releasing later this year. And then the second one is a practical checklist that came out of our operationalization paper this year that really talks about these rights and more specifics within each of these 5 rights that I covered here, and really gives entities and agencies an idea of what they need to do to make sure that they're in a place and ready to implement the indigenous determinants of health.
Thank you, Jeff. So we have just a couple more minutes left. So really the last thing is just, do you have anything else you want to say that you didn't get a chance that I didn't ask, which Jeff did automatically, which I love. Anyone else?
I'm sorry.
Yes, go ahead, please.
Yeah, I want to say something, and it's particularly serious, I think, and I feel that I really need to acknowledge it because I come from a particular place of safety, and I want to acknowledge some of the young people that have been here today that are not in a safe position, that when I say something like turn up, be present, actually it's not really possible for a lot of people. And I think I'm saying this for the people listening that aren't Indigenous, that they need to understand the reality, the stark reality for a lot of our people, that is not safe work. Just sitting here and doing something like this can be quite dangerous for a lot of our people, and we need to be clear about this is how serious we are about this conversation. Kia ora.
Miigwech.
I would like to back that up and
Yeah,
completely
100%.
agree. This week alone, we've heard of the jailing and murder of Indigenous peoples occurring during this forum right now. And we know that there will likely be people that are participating now that will, be subject to persecution or jailing, or be unable to go back to their home country or their territory because of their participation here. And I think it's important that we remember that and remember the seriousness of the messages that we give and the importance it is to protect those individuals as much as possible.
All right. Thank you very much, each and every one of you, for everything you had to say. For those of you joining us, if you want access to both reports, it's indigenousdha.org. Both of the reports are on there in multiple languages. Thank you.